Hello, it's Dr. Rhonda Johnson, and there is good news coming from the CDC. So today I'm going to be discussing the new CDC recommendations for fully vaccinated persons. And today is Monday, March 8th, 2021. Well, today the CDC issued its first set of public health recommendations for fully vaccinated people. So let's remember what fully vaccinated means. Well, if you've had 2 doses of either the Pfizer or the Moderna vaccine, or 1 dose of the new Johnson & Johnson vaccine, and it's been more than 2 weeks since your second dose of Pfizer or Moderna, or your only 1 single dose of the Johnson & Johnson vaccine, you are considered fully vaccinated. So these recommendations that the CDC issued today apply to fully vaccinated people who are going to non-healthcare settings. Remember, in healthcare, it's a different set of rules regarding isolation and protection. Okay, so what did the CDC say? First thing is that fully vaccinated people can visit with other fully vaccinated people indoors without wearing masks and without physical distancing. So translation, what does that mean? That means you got to know the vaccination status of people now. And if they're fully vaccinated and you're fully vaccinated, you can have dinner, you can hug each other, folks, and you can socialize with other fully vaccinated people. That's good news. Second is that fully vaccinated people can visit with unvaccinated people from a single household who are at low risk for severe COVID-19 disease without wearing masks or physical distancing. Now, translation, you got to know who is at low risk for severe COVID-19 disease. And basically, that's people who are young or people who are healthy without any complicated chronic morbid conditions. And again, being at high risk for severe COVID disease generally means having these following conditions or states, such as pregnancy or having any type of ongoing health condition that needs ongoing care, like high blood pressure or diabetes or kidney disease or heart disease or lung disease or HIV, or being a cancer patient who's being treated, or someone who's post-transplant, or someone with sickle cell, basically any kind of condition that places them at high risk for complications of COVID and death. So those folks want to be getting vaccinated as soon as their time comes in the line. Okay, next, people who are fully vaccinated should refrain from getting tested for COVID-19 and quarantine if you've been exposed to somebody with COVID-19, as long as you're asymptomatic. So let's translate that. If you've been fully vaccinated and someone tells you, I have COVID-19, again, it's 2 weeks after your shots, then if you're fully vaccinated, you don't have to automatically go get tested or go into quarantine for 14 days. There's a catch to this, unless you develop symptoms. If you develop symptoms, even if you're fully vaccinated of COVID-19, you should get tested and quarantine while you're waiting for your results. Okay, now the CDC also said, for now, fully vaccinated people should continue to wear a mask and physical distance when they're in public settings. When they're visiting unvaccinated people who are at increased risk for severe COVID disease, and I told you those folks, pregnant people, people who are receiving medical care for ongoing conditions, the elderly, they should wear a mask and social distance if they're visiting folks who are high risk for COVID who haven't been vaccinated. The CDC also says that people who are fully vaccinated should wear masks, maintain physical distance, and practice other prevention measures such as washing their hands when you go visit unvaccinated people from multiple households. So if someone's having a birthday party, we're getting ready to hit up into graduation party season, you should wear a mask, even if you're fully vaccinated, if you're going to be around people who are unvaccinated. Even if you're vaccinated, the CDC recommends that you avoid medium and large size in-person gatherings. Those are events where you have 50 to 100 or more people. And that you get tested if you're experiencing COVID-19 symptoms. Now, the CDC also weighed in on travel. Now, the CDC recommendation, the official recommendation, is still that Americans do not travel at this time. But if you do travel, you have to wear a mask on any type of ground, air, or by water transportation. And if you plan to travel internationally, you have to show proof of having a negative test result for COVID-19 no more than 3 days before you can board a airline flight to another country or travel back into the United States. So that's the recommendations. I know it's a lot. You may want to listen again if you're unsure. I'm also going to have the link for you so you'll have that as a reference. So get vaccinated, folks. We're starting to see the light at the end of the tunnel, and I hope that you've made up your mind that you're convinced these vaccines will be safe for you when your turn in the line comes. This is Dr. Rhonda Johnson. My views are my own. Stay safe and have a blessed day.